You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Greetings, everyone, and thank you for joining me on this episode. Welcome to Public Health Entrepreneurs. This is the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. If you are a high-functioning leader with expertise across different fields, whether you're a medical doctor, dentist, or pharmacist who also has a public health degree, or a public health doctor who also has expertise in another field, or any other interdisciplinary professional who I can't even think about all the combinations, but if you're any other interdisciplinary professional, you know what it's like to see opportunities that others miss. You understand the gaps in our current systems, and you have ideas. You have a lot of ideas about how to make things better. But sometimes having your unique perspective and all of your ideas can feel a little daunting, a little heavy, a little isolating. I definitely understand. And that is why I've leveled up this podcast to provide you with the type of support that you need. In today's episode, we're going to take the discussion from the previous episode about interdisciplinary advantage a little further to discuss leveraging multiple degrees in public health entrepreneurship. Embrace your unique combination of expertise as your superpower. Your diverse knowledge isn't a burden. It's a lens through which you're able to see other opportunities that others miss. I want you to always remember that. The first thing that I want you to remember as we go through this episode is the importance of understanding your unique position. The rising demand for interdisciplinary solutions in public health. We see that all the time. We saw it quite a bit during the COVID pandemic, and it doesn't go away. I remember feeling very isolated, and I thought I had to leave healthcare to then go into public health. Although deep down inside, I knew that the combination would be much stronger than trying to do one or the other. So there is a rising demand. It's not new, but it's definitely rising demand for interdisciplinary solutions in public health. You already know this. Understanding your unique position, also understanding why traditional single discipline approaches often fall short. If you really think about healthcare and public health as the example, healthcare does what it does. It responds to the crisis. It treats the individual. Public health serves populations and is focused on prevention. They independently do what they do, but when you bring them together, they're much stronger, much better together. One or the other separately can fall short. Healthcare is not going to do as much on the prevention side, just like public health is not going to really drive for the instant treatment one person at a time. But together, they're much stronger. Again, understanding your unique position, understand the unique perspective of professionals with multiple degrees. So if you think about the combination of degrees that you have, okay, so years ago, I did a lot of one-on-one coaching, and I attracted this type of client that you hear me describe all the time with a medical degree or doctorate in public health or pharmacy degree or some other terminal type of degree, and then another degree that's, I think of it as complementary, but they were always kind of like, well, what am I doing with this combination? So there's a unique perspective that you have, that you bring to the table when you have different multiple degrees that are slightly different. They can be completely different. That's even better. But when they're just two different or multiple degrees, you bring that combination together and it provides a very unique perspective. So all of that's under understanding your unique position. And that is how I need you to frame that and remember that. The next thing I want to point out is that there are some common challenges, and we'll just go through a few of those. Feeling pulled between different fields. That is a common challenge, and it's very different for each person, but there's that feeling like I described of having to do one or the other, or having to kind of identify in two different camps and feeling conflicted. Imposter syndrome in both domains. So I remember feeling okay, well, I've got so many years in healthcare as I was starting a little newer in public health and feeling imposter syndrome on this end. And then after a while, when they equaled out in terms of years, then I felt like I was a little watered down, not as strong in one or the other as if I'd been all in on one camp or the other. So that imposter syndrome, it's real. It doesn't go away. You just have to learn how to recognize it. But, that can be a common challenge. How to articulate your unique value position. Sometimes we have a really difficult time being able to articulate the value that we bring with our multiple degrees and varying backgrounds and different perspectives. And then another challenge is the strategies for integrating knowledge from different fields, really, finding the overlap and, that integration. But it can be done really, really well. Just a little hint there to encourage you. But those are some common challenges. Now, finally, I want you to note the importance of transforming limitations into advantages. So develop a framework or map out a map for your interdisciplinary skills. In the previous episode, I shared some action steps and some reflection questions to help you sort of begin to develop that framework for your interdisciplinary skills or to identify them. Identify unique opportunities at the intersection of these fields. So for example, just the sheer nature of the title of this podcast, and I mentioned in the introduction, this podcast covers topics of interest for those of you who are at the intersection of public health and entrepreneurship. That's a very interesting intersection that for a lot of people, they're like, maybe not so much now as it used to be, but really, does that really go together? But there are so many opportunities at this intersection. So identify those unique opportunities at the intersection of your fields. Now, I'd like to share some examples of how interdisciplinary entrepreneurs can leverage multiple degrees. So the examples that I'm going to share with you are inspired by actual clients that I worked with in the past, and then filled in some spaces with what I hear and what I've heard of commonly across examples of people who fall into this category. So like I said, I've attracted this type of client quite often. So let's just say the first example, maybe we're just going to talk about a medical doctor who also has a master's in public health. This is a very common one that I see very often. So let's just go through a little bit of a scenario of what's possible, okay? The background, imagine a pediatrician who also has a public health degree. The challenge is that this pediatrician has noticed high rates of childhood obesity in underserved communities. Maybe it's rural communities or inner city communities, but this pediatrician has noticed high rates of childhood obesity among underserved communities. The innovation here could be that this pediatrician created a mobile health app combining clinical expertise with public health strategies. In the solution, they developed an app that connects families with local healthy food resources. It provides telehealth consultations to families and tracks community health metrics, facilitates school-based health programs, and the impact is that the reduction in childhood obesity rates among the pilot community. So I put here, the impact could be reduced childhood obesity rates by 23% in the pilot communities. So the learning here is merge clinical expertise with population health strategies and, a little bit of information technology in there. But this is an example that you may have heard and not really considered yourself in a position to do something like this. But I've worked with clients who did something very similar, and I've met people who they didn't work with me directly, but I've met and I've talked with people and I've interviewed them on my other podcast who have done this exact thing. They saw a problem, they addressed it with innovation and put their various backgrounds together to be able to provide a solution, a very creative solution that was serving a community in a way that they were uniquely designed to do. So let's give you another example and scenario. Pharmacist who also has a master's of public health. Again, this is something that I've seen quite a bit. I know several pharmacists who are this combination of pharmacists who also has a public health degree. So background, clinical pharmacist with a public health degree and public health background. The challenge, medication adherence issues in elderly population. So the pharmacist noticed that like they work in retail pharmacy, and their older patients were not adhering to the medication. Just noticed this pattern and trend. So they addressed it with innovation, which was created a community pharmacy program integrating social services. So the solution was a new program that featured medication therapy management, home delivery services, social worker partnerships, health literacy education, because, again, meeting the needs of this elderly population, we can generally accepted information here, common knowledge among the industry, lower health literacy, and access to technology that a lot of people are using now to understand in their health instructions and their medication and their disease and condition. It puts the elderly population who are not maybe as tech savvy or have access to internet and resources like that at a little bit of a disadvantage. So the impact is that they were able to improve the medication adherence. So they combined their pharmaceutical expertise with social determinants of health and was able to have a great impact. Now it's your turn. What can you create? Or how can you level up what you already created? Remember, a leader with expertise across different fields, you have an interdisciplinary advantage. Before we wrap up today's episode, let me ask you, are you ready to take the next step in your public health entrepreneurship journey? Well, I have 2 ways that I can support you. If you're looking for personalized guidance, let's work together one-on-one. As someone who understands the unique challenges of being an interdisciplinary leader in healthcare and public health, I can help you turn your innovative ideas into reality. Or if you are ready to join a community of high-functioning leaders like yourself, consider applying to our premium mastermind group program. You'll connect with other professionals who, like you, are bridging multiple disciplines and creating meaningful change in public health. Either way, you can find out about these opportunities through our website, publichealthentrepreneurs.com. Now, we don't have a page or details about working with me one-on-one because that's a service that I typically have not been able to offer. However, for this season that we're in now, I am offering that. So there are limited opportunities, but just submit a contact, just reach out through the contact us page on our website and let us know you heard this episode and you'd like to explore that opportunity of working one-on-one. If the mastermind group program is not, if you want some help right now, because we only open that mastermind program twice a year. So you may not be, depending on when you're listening to this, enrollment may not be open. So either way, visit our website and you can connect with us, reach out to us and let us know that you want to explore those opportunities. We're happy to help you sort it all out, as my British friends say. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.